Live from Victory Park, this is Good Morning Texas.
April is Oral Cancer Awareness Month. Did you know that smokeless tobacco contains at least 28 cancer-causing chemicals and is a known cause of oral cancer? And it's a habit all too common in baseball, and it's baseball season. Dr. Shradha Rajbhandari from Great Expressions Dental Centers is here with some important information. We talk about baseball season and smokeless tobacco, and that's just one of the many causes of oral cancer, which is a very serious thing and increasing.
Yes, ma'am. So basically, tobacco remains the leading cause of oral cancer. That includes everything from cigarettes to cigars to pipes and chewing tobacco. But one thing a lot of people don't realize is alcohol is another major risk factor. Patients that consume 3 to 4 alcoholic beverages per night are at a much higher risk. It's actually double in those patients.
And oral cancer is on the rise.
It is,
right
absolutely.
Now.
It's very important to bring about awareness to oral cancer. It's not something that's oftenly brought up.
So what are the things that you would look for? What are the symptoms of oral cancer?
So patients should really be doing monthly self-examinations at home. You should assess your face, your neck, the inside of your mouth, your lips. Those are often common areas. Inside the mouth, the tongue is a very important area to examine. The floor of the mouth, the gum tissue, all of those areas are susceptible.
And what exactly would you be looking for? I mean,
so
a lot of people get what you call fever blisters under stress or things like that. What would you be looking for?
Well, if a sore or ulceration lasts for more than 2 weeks, that's definitely something to not ignore and contact your dentist immediately. Anytime you have tenderness or pain or areas of numbness, those are also signs that are serious and need to be assessed.
So what happens during a screening for oral cancer?
Right. So as dentists, people think that we're only examining the teeth, but when you come in, we're looking at everything. We're looking at your face, your neck, the inside of your mouth. We're checking for any signs of abnormalities. If we should see anything that poses a concern, we'll then go ahead and refer you to an oral surgeon, and they'll assess the area with a consultation. If they're also very concerned, they'll set you up for a biopsy. And you know, with oral cancer, early detection is extremely important.
I was going to ask that. Is that like some other cancers where if you
that's
detect
with
it
most
early,
cancers, yes, ma'am.
it makes all the difference.
It does. If it's detected in the early stages, you have an 80 to 90% survival rate, whereas if it's found later on, the prognosis is not good.
Okay, and Great Expressions Dental is doing some special things to help people.
Yes, absolutely. So Great Expressions has already donated $2,500 to the Oral Cancer Foundation, and every time you come in for an appointment to see us, we are doing full oral examination and checking to see if there's any abnormalities.
Okay, so you said smokeless tobacco, of course, any other kind of tobacco.
Yes.
And alcohol is a big factor.
Right.
What are some other common factors that people, if you engage in these activities, you need to be careful?
Sunscreen is extremely important. So oftentimes, you know, when we're going on vacation and we're not going to be outside for prolonged periods of time, we think to put on the sunscreen, but it's really important to wear it every single day. Even on cloudy days like today, 80% of UV rays actually pass straight through the clouds. So it's very important to protect your face. Also, chapstick with SPF is very beneficial since the lower lip is very susceptible to oral cancer.
Because your lips are very delicate.
Yes.
Thin. Okay. Well, thank you very much for being here.
Thank you for having me.
It. Good time of year to think about this. Great Expressions Dental Centers has 16 locations in the Dallas-Fort Worth area. Call 888-SMILE-80 or visit greatexpressions.com for more information.